Hi, I'm Dr. Bill Johnson. We've been doing Good Morning Texas segments for almost 12 years on cosmetic surgery and stem cells. Please enjoy the segment and be sure to punch the button to subscribe.
Do you remember when it first started?
It's a new month. Are you ready to fall into a new you before the holiday season begins? Well, Dr. Bill Johnson of Innovations Medical is here to talk about their two of the most popular cosmetic procedures, that is the buttocks and the breast augmentation. Good morning.
Good morning.
Okay, I'm ready for September, but I'm ready to get into this body that I want before we have all the challenges of the holidays. So we're going to dive right into it. What is buttocks augmentation?
Well, buttock augmentation is just that, making the buttocks larger. Most time in the United States, that's done with your own fat. So it's fat transfer, fat grafting, and it's been commonly known as the Brazilian butt lift.
Mm-hmm.
It's because we liposuction one area where we have a little too much fat, like around the waist, and make that smaller, and then we take that fat and transfer it to the buttocks.
How nice that looks.
This procedure has become so popular that last year a person had it every 30 minutes.
Why do you think it's become so popular?
Well, part of the reason it's become so popular is fashion trends have changed. And we've gotten to the point where we like a little more shapely, a little rounder here and there. Part of the point is it combines two very safe office-based procedures. So we do liposuction in the office under local anesthesia. We do the fat transfer at the same time. And they're very safe. That also, by doing it in the office, keeps it much less expensive, so they're quite affordable.
You're killing a few birds with one stone also.
Yeah, it's a really good 1-2 punch.
Okay, we all come in different sizes and shapes, of course, back there. And so how do you deal with that issue?
Well, having a lot of experience is really important when you're doing buttock fat transfer. We've done over 700 cases, and that makes a big difference when you look at different sizes. We've seen just about every size and shape and had a good result with all of them.
Okay, that's why your experience is so important, especially when that's something you want to get done back here. But let's talk about breast augmentation, and that's what we have here.
So breast augmentation in the United States, implants are by far the most common. But with natural fat and natural breast augmentation, fat's really making a big surge. It's really starting to increase in the market. Part of that's because folks like the idea of it being more natural. Part of that's the techniques have gotten so much better. We often add platelet-rich plasma, or PRP, to the fat when we're doing breasts, and that raises the survival rate up to around 90%.
Other than that more natural look, what would you say are some advantages to that fat transfer?
Well, the advantages of fat transfer is it has a normal texture. It can't get firm or form a tight capsule the way implants can. There's no reaction, no capsule forming at all, so you just don't have that issue. There's not a foreign body. So it has a more natural look, a more natural shape, a more natural feel, and there's no chance of any rejection or reaction.
You know, we were talking about trends earlier, and I think this is also the new trend, is that more natural. You might want a more fuller cup or a more whatever it may be, but natural, and that's what's important.
And both of these combine a real 1-2 punch. That idea of taking a fat from an area where you don't want it and moving it to somewhere where you do. For years, that was the dream. Now it's the reality.
And may I also mention what I have learned by speaking with you here on GMT is that if we get something done now, we're going to see the full result later down the road. So if this is something you want maybe for the winter or spring or even getting ready for next year, this is the time to do it.
Folks that are thinking about a spring break vacation right now is really the time. Because in spring break, you're going to be seeing your full results.
And you have a fat transfer special.
We do. We're going to take $1,500 off your fat transfer procedure, but only for 2 weeks. So that's going to fill up pretty fast, so folks need to call now.
All right, Dr. Johnson, thank you so much for this great information. If you're thinking about spring break or just thinking about looking down and not being very pleased, you can give them a call. Ask some questions. They'll do that for you with a free consultation. It's Innovations Medical. They have locations in Dallas, Frisco, and Fort Worth. Here's the number to call, 214-420-7970.